Hello student nurses. In this video we're going to be going over the heart anatomy. So before we get into actual anatomy, we're going to be doing some orientation. So as you see up here, we have the right side and the left side. This is opposite of us because we're looking at it as if it were a patient. As you see down here, we have the apex. It's this little point part of the heart that is always towards the bottom. And then this part up here is called the base. It's counterintuitive because you'd think the base would be at the base, but it is not. Okay, so now let's get into the anatomy. I will be naming off the anatomy as the blood would flow through the heart. So we have the superior vena cava here and the inferior vena cava here. These lead into the right atrium. From the right atrium, it flows through this right AV valve, or the right atrioventricular valve. It also has another name, which is the tricuspid valve. It's tricuspid valve because it has 3 leaflets here, here, and here. From here we go into the right ventricle. From the right ventricle we go into the pulmonary artery through the pulmonary valve, which is a semilunar valve. From the pulmonary artery it goes out to the lungs, and then from the lungs getting all oxygenated, it goes into the left atrium through the pulmonary veins. As you see, we have 4 of them, 2 on each side, pulmonary veins, pulmonary veins. They go into this left atrium, and then they travel through the left AV valve into the left ventricle. This left AV valve, or left atrioventricular valve, also can be called the mitral valve, or it can be called the bicuspid valve. Since it has 2 leaflets, the bicuspid, so two leaflets here. A way you can remember the tricuspid valve and the bicuspid valve is you try before you buy. So tricuspid valve, bicuspid valve. After it goes into the left ventricle, it will then travel into the aorta through the aortic valve. This is also a semilunar valve. From the aorta, it will go to the body through the brachiocephalic artery, the left common carotid, and the subclavian arteries. That is to go up into the head, neck area, all of those. And then down here, this is also part of the aorta. This will go to the rest of the body that's below the heart. Some things that I want to point out here is this little black dot here. This is called the fossa ovalis. This was, when we were in utero, the foramen ovale, which would shunt blood all the way across here. It was like a tunnel, but when we're born, it's supposed to close up, and then it leaves this little scar. Next, we have these little muscles here. They're actually in the right ventricle and the left ventricle. These are called the papillae muscles. These papillae muscles are connected with the chordae tendineae to the valves here. This helps ensure the one-way flow of blood and no mixing of blood. It helps these valves stay closed when they're supposed to and open when they're supposed to as well. The function of these valves here, both the right and left AV valves and the semilunar valves, are there to make it so the blood can't get back and mix with the blood that it was previously in. So We want blood going from right atrium into right ventricle. When the ventricles contract, we don't want any of the blood getting back up into the atriums. This is it for the anatomy of the heart. In the next video, I'll be going more into depth on the blood flow of the heart.